Well, good morning, everyone. We hope you had a great weekend. We've got a fantastic show lined up for all of you today. Of course, friend of the show, journalist Zed Jelani, will discuss what the Biden administration is doing to get a handle on violent crimes and what Biden had suggested under President Obama when it comes to gun control. Plus, James Pogue discusses the latest on what's happening in South Africa after major looting and riots shook the region following the imprisonment of the country's former president.
But first, we want to start by breaking down some COVID numbers around the world. The Financial Times reports that as the Delta variant goes global, it's a tale of two pandemics. One, the heavily vaccinated Western world reopening, while areas like Asia and Africa are experiencing a soar in death tolls. Here's a closer look at a chart from the Times on well-vaccinated countries, where you can see that the Delta surge in cases is no longer mirrored in deaths in highly vaccinated countries. In the UK, a little more than half the country is fully vaxxed, and mortality rates in all of these countries are only a fraction of the actual Delta cases. These are fascinating charts because you're seeing that we're facing another wave around the world, and the wave is hitting countries that are vaccinated and unvaccinated. Now, the wave is smaller in countries with vaccinated because there are fewer pockets of unvaccinated people to infect. But what you're seeing is that as you're seeing these breakthrough cases, those people aren't dying, and so you get this interesting chart. Cases up, but death numbers staying flat. Do you think this will persuade people that if they're in a high-risk category, they really do need to get out there and get vaccinated?
You know, I actually think it will because, and the reason we're leading off with this on a Monday morning, by the way, is because I think it's weighing on a lot of people's minds. We saw Los Angeles bring back indoor mask guidances over the weekend, and I think a lot of people are worried that's going to, as this wave spreads, that the waves of mandates and lockdown requirements, et cetera, will spread back to their locality as well. I don't think that's likely to happen. I think we've seen that, people have really had enough, and I'm not sure that it would be effective even if these localities really tried to do that. I did hear on the way over here a little bit on NPR talking about how you basically talking about the Delta variant in the context of people still should be wearing masks. And so again, I think that's why this is probably front and center in everybody's mind. But to your point, and to the point that is documented by these charts, it's a different wave, but it's also a different wave. It's also a wave with different characteristics. Right? So it doesn't look, and it's not affecting people because of vaccinations and because of the way, if you're vaccinated, it's a different ballgame. So if you're unvaccinated, it's also a different ballgame. It can be a lot harsher if you get the Delta variant, but if you're vaccinated, you're probably going to have a lot easier time with it and even be asymptomatic. And
the unvaccinated population skews heavily younger. Definitely under 70, under 60. Plenty of people in their 50s are unvaccinated, but the lower you go down in the demographics, the higher you find unvaccinated rates. So that's also why you're seeing it's not just breakthrough cases. Significantly, it's younger people who are getting infected, and they're not being hospitalized, and they're not dying because, as we've known from the very beginning, this is a disease that hits older people much harder. That's where the death rate comes in. We are getting mixed signals from places like Los Angeles. Everybody go get vaccinated. The vaccine works. Oh, but even if you're vaccinated, you still have to mask indoors. So people are getting confused about that and wondering if, are we headed for another lockdown? What is going on here? And so while death rates are coming down this past year, and there were new numbers that came out recently that showed that deaths from opioid overdoses just absolutely skyrocketed over the past year. And we look at this chart right here.
It's one of the biggest consequences from those lockdowns. These staggering numbers of overdoses in the United States. 93,331 Americans died of overdoses in 2020. That's a 30% increase from the previous year. The deaths were highest in the months when the early lockdowns were the most strict. That tells you people may have been overdosing and not been in company that could help them get the medical attention that they needed. Early numbers indicate at least a flatlining or a plateau in suicides, but you have this 30% spike in drug overdoses, which was already increasing. You can see that on the chart. It was already ticking upwards. But to go from that to 30% increase during the pandemic year, the reason, again, this is our lead on Monday mornings, because this is a huge, huge story in that people are going to be concerned. More lockdowns, more isolation. The Delta variant is one wave. People are going to start saying, how many waves will there be? How many times will we have to endure the isolation of these lockdowns going forward? And so I think people are paying very close attention to how the government reacts to this first variant. There could be more issues with COVID down the line, and people are saying, we saw our communities shattered. We saw people overdosing. We felt the isolation ourselves. What's the future in the country look like?
And one thing these numbers point toward is a complete failure of the drug treatment industry.
Absolutely.
The dominant model of opioid treatment in the United States is basically taking the AA model of complete abstinence, take it day by day, and transporting it over toward opioids, which are just a completely different substance, and affects the brain differently. And so studies have shown that type of treatment is just not very effective for people. And so I think if we bother to study this, which is not obvious that we even will, because we don't care about these types of deaths of despair in this country. If we did care, we wouldn't have deaths at this number. But if we looked into it, I bet you would find that the overwhelming number of these people, almost all of them, were relapses.
Yes.
And coming out of the coming into the pandemic, like you said, they're alone at home. They hadn't used for some time before, and so now their tolerance is down, and there's nobody around. They use the same amount they had used before, and boom, now that amount is enough to kill them. When before it would have been okay because their tolerance had been higher. Now there is medication, buprenorphine. Democrats and actually a bipartisan group in Congress has been calling for buprenorphine to be made available much more easily to get the DEA out of the way. This is medication-assisted treatment. Anybody who has a loved one, or if you're suffering with a substance use disorder, ask your doctor about this. The AA community hates it, but medication-assisted treatment gives you a medication that will counteract the potential of an overdose. It's supposed to stave off the cravings, and also if you do relapse, it's supposed to keep you alive.
Yeah, no, and this is all important. And what are we hearing from people in our government when you have a 30% increase that'll actually take those numbers down? And that opens up a conversation about the deeper cultural roots of a lot of this, and that's an important conversation to have, even though it's an incredibly difficult one for people in our political establishment and our corporate establishment to have. A very, very difficult conversation for them, because it implicates them on a wide scale. But even just looking at, as you say, our sort of approach to the drug war, it's been with opioids in particular, the way that fentanyl is so much easier shipped, packaged, and it's so much more potent. The way that we dealt with the opioid crisis by just blanket, trying to revoke the amount of prescriptions that were given for opioids without really thinking about the fact that there would be consequences in the fentanyl market, which, by the way, a lot of it comes from Wuhan, China. This is a serious problem that's all interconnected. And I remember, actually, I just pulled up this article. May of last year, I interviewed this guy, Tim Ryan. He's a substance abuse counselor, works on these issues. He's a former heroin addict. And this was in May of last year. And the data is now bearing this out. He said relapses are through the roof. Overdoses are through the roof. He called it a pandemic within a pandemic. And I think that 30%, 93,000 deaths has borne that out, especially in the time period where he was telling me that he's hearing from parents constantly, he's hearing from loved ones constantly. This was back in May 2020, that people are just relapsing en masse. And these addiction treatment centers, rehab facilities were just completely booked up. People were having a hard time getting in. And now it's July of 2021, and we know we're starting to have a clear picture of exactly how bad it was.
Yeah, and I think that from now on, that the U.S. administrations, should put fentanyl on the table when it comes to negotiations with China.
Absolutely.
At this point, and maybe that's a capitulation But they need to recognize that China is an authoritarian country that has facial recognition and can find out if you walked from your apartment to a drugstore nearby. They know who's producing and exporting fentanyl, and clearly there are elements of the Chinese government that are completely comfortable with the export of it and what it's doing here in the United States.
Yeah.
If you're looking at foreign policy as a zero-sum game, and if you think that you can harm the United States, harm its industrial capacity, harm its manufacturing capacity, hollow out its an entire generation of people, then from a zero-sum perspective, you're like, well, let's go ahead and do that. Mm-hmm. And so we should, I think, push back on that and say, no, this needs to stop.
And people are parsing the numbers between South Dakota and Florida and New York and Connecticut and California. But what we don't have factored into those numbers yet is exactly how the lockdowns actually may have triggered. And that's a hard thing to quantify, but we don't actually really have that. And now we're thinking, how an easing of those lockdown restrictions could actually ease this crisis of drug overdoses. Now, CNBC asked the director of the National Institute on Drug Abuse about this. Let's play that clip.
One of the factors that contribute to the increase in drug use was the isolation, social distancing, that, as mentioned before, does not allow you to provide with Narcan, which reverses overdoses. The despair that people felt hopefully will start to be mitigated on the one hand as we control COVID better with vaccines, and second, as more people are able to build up the social support systems that existed before the COVID pandemic, and the healthcare system can focus again on providing treatment for opioid use disorder, which was, of course, subverted by the need to take care of patients with COVID.
And let's also not forget that Black Americans have been disproportionately affected by drug overdoses around the country. According to the AP, you can see that graphic right there. And here again, what we just heard from her and what we see in this graphic and from this Associated Press story is that to really have this conversation, there are policy things that you can do. You can put this on the table with China. In fact, you must put this on the table with China. You can rethink your approach to dealing with the opioid crisis. But the much more difficult, much more important thing to do is deal with the systems and to deal with the roots. And
right.
I don't see us making any strides towards that at all.
Right. And the pandemic was like a wedge that was driven into the cracks that already existed in our society and making them that much greater. Any hope that we had that the opioid epidemic was waning was disabused by this past year of the pandemic. We have spent countless hours on cable talking about the 600,000 people who died of the coronavirus. Almost 100,000 people dying of opioid epidemic, and it gets barely any attention. Yeah,
barely any attention. And it was never a part of that conversation, at least in the legacy press, about what these lockdowns were. We were just told, lockdown, you have to do it. It's the right thing to do, with really very little regard for the effects that isolation would have on people struggling en masse with substance abuse in this country, which we knew. It became an issue in 2015 Republican primary, 2016, actually they're talking about it in 2012. If you remember, in New Hampshire, they were hearing so much about it at that time. This has been on people's radar here in Washington, D.C., in the Acela corridor more broadly, but it never gets top billing.
No, it doesn't. No, it doesn't. We'll tell you what's on our radars up next.